Hello and welcome to It's Your Case, brought to you by vetct.com. I'm Lucy Meehan, the radiologist on demand for this case. Today's case is a 5-month-old thoroughbred colt with a history of left hind limb lameness of about 4 weeks, and the lameness is improved 70% by a low 4-point nerve block. Once you've reviewed the radiographs using your systematic approach, you're ready to watch this video. So I'm going to highlight the most important points relevant to this case. It's quite a short one today because there is one main area of pathology. So starting with the images that we've got on the screen, we've got a lateromedial. It's a really nice lateromedial of the fetlock. Sorry, I've just lost the image. It's a really nice lateromedial of the fetlock where we can follow the sagittal ridge all the way around, and our sesamoids are nicely superimposed. So that's what we're looking at when we're looking for a good lateromedial view. We can see our patient's young, so our proximal physis, the proximal phalanx, and our distal physis of the distal third metatarsal bone is open, and there's nothing really else to comment on the lateromedial view. Similarly, this is our dorsolateral palmar medial oblique, so we're highlighting the lateral side of the joint here. So this is our lateral sesamoid bone, and really that all looks nice and normal for a foal. If we just skip over one and we look at our dorsomedial oblique, so this is our medial sesamoid bone here, and you can see that all looks quite normal as well. So if we just look closely at our dorsopalmar view, so I'll just bring that distally a little bit. So we can see our physis is partially closed, but that's consistent with the age of the foal, and this all looks perfectly normal. There's maybe a little bit of soft tissue swelling here, but not very much. And as we look through the joint here, we can see this is our sagittal ridge, and this should all be nice and round. And you can see that we've got quite a shallow but well-defined defect within the sagittal ridge here. And you can just about, with an eye of faith, see a small fragment just here distal to the defect as well. So this is an uncommon cause of lameness. This is an osteochondritis dissecans fragment within the metatarsophalangeal joint. They're very unusual in this location. However, they do occur, and I would strongly advise that we radiograph the contralateral fetlock because these are usually bilateral, so I would always see both, and then examine the patient thoroughly for any other signs of osteochondritis, because as we've discussed before, it is a systemic disease, so you can have more than one joint affected. This is a really, really nice example of this pathology, and like I say, it's one we don't see very often, but it's one to be mindful of. So I hope that answers any questions that you had with this case. Don't forget to It Is Your Case, so if you have any further questions, please post those on social media. Thank you.